So with that, I think unless there's any questions, additions, deletions from the agenda, I think we want to move forward with our agenda. And I would like to introduce to you and bring up to our floor Hank Hannigan, who's the Chief Executive Officer for Whitman Hospital Medical Center. He's been there since 2014. Hank is a lifelong resident of Washington and most recently worked as the Chief Operating Officer at Whidbey Health on Whidbey Island. He received his master's degree from WSU Vancouver and his bachelor's degree from Gonzaga University. So he's an okay guy. On the state level, Hank is an active member of the Washington State Hospital Association's Public Health Policy Committee and Rural Hospital Committee. Locally, he serves as a board member of the Northwest Rural Hospital Network and the Whitman County Health Network, and has recently joined the Colfax Rotary. So Hank, welcome, and thank you for taking the time to be with us today.
Thank you very much. Make sure this is working. Yes, good. All right, well, first of all, I'd really like to let Ed and Travis and the rest of the coalition know what a pleasure it is to speak to you today. I'm always looking for an opportunity to get to sell our community and the great work that we're doing at our hospital, and this means quite a bit. What I'd like to do today is spend a little bit of time just giving you some information about us. It is our 125th birthday this year, and I feel it's important maybe to go back to our roots for just a minute on that. But I really want to put some energy into what we have done, especially within the last couple of years, to really change things in our hospital and how we approach and prepare for what I hope never happens, which is a big emergency in our area. So that's what I would like to do today. Believe it or not, this is our first hospital, or was our first hospital. And many of you may wonder why healthcare keeps going up. I'm telling you, if we would have stuck with our roots, we could really have control of this. We actually saw 62 patients in this shack, believe it or not. But it had to start somewhere, and we thank the sisters for that. Then it was St. Ignatius, and I like to joke because of what this has turned into now, but this building is still providing care. It's care to spiritual beings usually. We have this has really turned into a novelty now, where we have groups come and tour looking for ghosts, and I'm being serious. So that is the old hospital. I don't personally spend a whole lot of time there anymore. This is what happened in 1968. So we've had a lot of transition, and really the community came together and saved healthcare in our area. Otherwise, we would not have it today. A few individuals felt it was important. They went out, they fundraised, they knocked on doors, they begged, and they were able to build this 48-bed hospital. And thanks to that effort, we're here today. This outline, which encompasses most of Whitman County, is what we call our public hospital district. And you can see we serve most of the square footage, not necessarily most of the population, but we go out and encompass about 1,200 square miles, which is quite a bit. And so we have what I feel is a lot of responsibility and a duty really to do what we can to be on top of our game and making sure we have services available for this large population, or large area, excuse me. And this is what we look like today. We've actually decreased in beds, which I think is a common thing for many hospitals. We are not seeing censuses going up. We're seeing them going down. There has been a shift to outpatient. But most of our energy, honestly, is not in the inpatient area anymore. I wouldn't call us a full service hospital, but we are definitely a hospital that I believe is providing the services that we should provide, because there's actually a lot of things that we shouldn't provide. This just gives you an idea. I'm not going to go through all of these things, but I think you can see, even for a small area, I mean, we're doing quite a few things, which requires quite a few talented people. Here's some key statistics just to let you know what we're about. I did want to highlight the surgery area. We do many kinds of surgery. I do believe that if we did not do surgery in our hospital, we would probably end up being an emergency room, maybe doing a few diagnostic tests, but that's really what keeps us going. And I don't know if you guys are aware of this, but we actually partner with 2 other Palouse Region hospitals, Pullman and Gritman, in order to employ specialists that actually cover the 3 hospitals. And so we do that with general surgery, we do it with ENT, we do it with urology, and we're also trying to do it with oncology. And that's another way that we all 3 have been able to continue to exist. I do want to talk about quality. One of the things that drives me crazy, honestly, when I am reading and listening to people talk is I always hear, well, if you're small, then therefore you are no good, or not as good, or we shouldn't go there. And I am extremely proud of the things that we've been able to do. Patient satisfaction, for one. I mean, this is a 100-point scale, and to be in the 92nd percentile of that and is just phenomenal. And I'll show in a minute that that's translated to some other awards for us. But you can see we believe in preventing everything that we can, which is why we focus so hard on medication scan rates and letting the computer do a lot of the thinking for us. I'm also extremely proud of the surgical site infection. I mean, we have not had an infection in almost 3 years. And that's really unbelievable. I honestly can't believe that. So we better make sure that continues. A couple of things just jumping down to the bottom. When people come to our hospital, and we are staffed 24/7, they are going to be seen quickly. And it's kind of interesting. We have a 19-minute wait, which I'm sure all of you know in an emergency room, at least in the big cities, it's just not going to happen. And we often find actually that when people have to wait more than 5 minutes, they sometimes become irritated in our community. But we're still very proud of that, and that is way below the national average. A couple of things, just so you know, so we actually have been recognized as a 5-star hospital. We are the only one at this time in this region. And there's only a few in this area, so we're pretty proud of that, even though there's a pretty significant debate going on about how valid that star rating is, but we'll save that one for another day. And we've also been recognized recently just as being in the top, I'll just say top 100 critical access hospitals in the nation, and we continue to do this, and honestly that goes back to the people and the quality that we're able to give. I wanted to shift gears now, unless there's any other questions I might be able to answer about our hospital. We'll just pause for one moment. Okay. To really what we've done, and I want to focus on the very first thing. So when I came to Whitmer Hospital in October of 2014, what I noticed is that emergency preparedness, safety, security, was really something that was in that well, we do this just because we have to call them. And Bruce, you can interject if you'd like any time, or if you disagree with me, but I just didn't feel that we took it seriously. We didn't have a high functioning safety committee. We had just a part-time person who, sometimes made sure that we had the drills we were supposed to have, and sometimes made sure we had training. But there just was no energy around it, and it was really disappointing to me, because I believe that if you are prepared and you do all the work, your chances of it happening usually go down. That's just the experience that I've had. And then, of course, if it does happen, then you're ready to go. So I went in and we restructured right away. And I felt it was more important to look at other leadership positions that we had, because we did not have a manager at that time, and reduce those positions so that we could create a leadership position in safety and security emergency preparedness. And we did that, And I'm very thankful for Mr. Haley here to have accepted that position, because things have just gone up since then. It really changed our entire perspective at our hospital. One of the things Bruce has been able to do with him and his team is we've had NIMS training. We have people who understand what it is. About 15% of our workforce of about 200 people have been trained in it. Some have just had base level, and then we have another group that's gone on and had the 700 and 800 series. So that was huge. I had come from facilities where it wasn't an option. I mean, that was actually just part of the deal for working there, is you had to do it. But at our facility, it had to be ingrained. We had to do a bit of hardwiring. So that has been real exciting. Another thing that Bruce has really been integral in is making sure that we have hands-on training. We don't just look at it in a book or talk about it for 5 minutes in a staff meeting, but that we actually do it. And I've got a couple of pictures here, but you know, when the med sled, and you guys are familiar with that, I'm fairly certain. So we are a storied hospital, and we want to be ready in case we have to evacuate. And so Bruce very wisely decided that, you know what, if we're going to practice this, we need to practice it with real people. And not just real people doing it, but real people even in the sled. And I was the first to be volunteered for that, but luckily came out of it okay. But anyway, things like that, fire extinguisher training. Bruce, we had 200 and some people trained this summer for that, the real thing. And the feedback from staff was incredible. Most of them had never touched a fire extinguisher before. So it was just fantastic. Those are just a few examples. Also just participation in the coalition. I don't know how long the coalition has been in existence. It's been some time, I would imagine. I'm fairly certain that we didn't participate regularly. I'm fairly certain that we didn't participate maybe a whole lot at all. And I do believe we're an active participant now, and that we continue to put energy into that because of how important we believe it is. Another thing I'm very proud of, and I know a couple of you have been to our facility, but we actually have an incident command center that is an incident command center. It has no other use or purpose. Primarily, it's there, it's ready. We're still trying to finalize it, but I mean, we have telephone, we have copier, we have maps, we have whiteboards, we have floor plans. We've got, for the most part, everything you would need in case that's happened. I'm very pleased that we haven't had to use it yet, but we're ready to go in case that we do. And again, this is all back in my mind to dedicating the resource to having leadership there. One of the other things that is related to this that I think is worth mentioning is the work that we've done in terms of securing our facility. I come from bigger places. In fact, my career has actually started at a 200-bed hospital, and I just gone down every step. I'm not really sure what that means, but clearly it's getting better. But what I noticed when I came to Colfax is, you know, and this is sad, but is that there was such a feeling, a relaxed feeling, you know, we're family. There's no reason to have locked doors. There's no reason to do this. There's no reason to do that. And I had a hard time at first convincing people that, you know what, we have an obligation not only to protect our patients and their families and visitors, but we have to protect our staff. And stuff happens. And I was able to provide, unfortunately, real examples from my past lives of things that happen and why we need to do it. And so Bruce did an assessment, and we have invested, I would say, probably close to $100,000 in tightening up our facility, and that's improving lighting, some of these things that are up here. And to me, this all ties together and has made us a better hospital. Just a picture of one of our clinical coordinators, one of our weekend and night leaders practicing on that. And the other thing, there's the med sled, and finally the setting up of the decontamination tent. So we really believe in doing it hands-on at our facility. So that, for the most part, was the overview that I wanted to provide, and I just wanted to open up to see if there are any specific questions that you might have, or if you wonder how or why we're doing this. Travis?
You mentioned the expenditure committed to security and other investments. I'm just curious how you're continuing to work with your board to help them understand the value in that return on investment. How are they starting to really realize the results of that investment? So I think there's a lot of organizations that could really benefit from understanding how that's being translated from the financial perspective and also, again, the leadership perspective.
That's actually a great question. I really believe when I'm working with the board that the best way I can let them know about why things are important, why this investment is important, is to give them real life examples. And so Bruce and the leaders at my hospital will often hear about, how important networking is, and I want you out of the hospital, and I want you to talk to people. Well, I do the same thing. I try and model that myself. And I often ask other CEOs and so forth about experiences that they have. And whenever I have something like that, I grab onto it and I bring that back, and I'll say, hey, do you remember when you approved this or when you agreed to visit? Well, I want to tell you why this is so important, because this hospital didn't do that. And this is what happened because they didn't do that. And I use that every time something new comes up, and it really, in the beginning, it was harder. But I will tell you now, it's an easy sell. I really don't have to put any energy into it. They understand the importance of it and want to invest in it. So, all right. Well, again, I thank you very much. It's been a pleasure.
Okay. So I got to tell you that over the years, you're right, there are times that Whitman Hospital was not all that active. There was times when I look at this picture and I'm really excited to see that, because there was a point in time when the hospital actually thought about getting rid of their decon equipment. So it's really excited to see now you're using the equipment, which has kind of become standard practice for a lot of our hospitals. So the other thing I would throw in there when I look at what Hank has accomplished and Bruce down at Whitman Hospital is just to give a little historic perspective of my own, being in the Pacific Northwest for a lot of years. I won't say how many. But I remember being younger in high school and college, and I had family in St. John, and my niece would break her ankle or something would go on in the family, and they would have surgery, and I would say, where did you go? Well, we went to Whitman Hospital, and I'd look at them and I'd say, really? Why don't you come to Spokane? But as you go on, and I've seen what Whitman Hospital provides, and I've learned a lot of our rural hospitals do the same thing. They really are a powerhouse out in those communities, and they really do provide a lot of great services, and can do a lot of great things with healthcare in their communities. So it's just really exciting to see them here involved in helping us do our work, because they really do phenomenal things in their rural communities, even though they don't have the staffing, they don't have the resources, they don't have the people, and they have the smaller client population that they serve. So it's really great to see some of the exciting, great stuff that they do. And one more soapbox question statement. I talked about our situational awareness process. For those that aren't familiar with it, there are some samples back there on the bench back there. So grab that, you can look through it, you can see what it provides. If you're not part of it, take it home. It's got our email address, it's got our website address on there. So please take a look at it and give us a call, and let's get you connected so that you can be part of it.